So now let's look at cognitive behavioral therapy. And the original CBT for eating disorders was developed by Fairburn and Wilson in 1993. Wilson was my mentor. But let's jump back and briefly talk about the cognitive model of mental issues or problems in general. So CBT, cognitive behavioral therapy, was really developed by Aaron Beck, who recently died at the age of 100. And this is a basic model of the interaction of thoughts, feelings, and behaviors that maintain a problem. So for example, in depression, the feelings would be low mood. The behaviors would be things like isolation, not participating in activities. And some of the thoughts that would emerge would be, I'm not good at this. No one likes me. I'm always going to feel this way. And so the treatment targets the behaviors and thoughts to try to change the feelings. So some of the first steps in CBT for depression include what we call behavioral activation. That's changing the behaviors, getting the person to get up and get dressed and do activities. And that's usually the first step. And then we work on addressing some of the thoughts. So challenging some of the negative thoughts, like, this is never going to get better. No one likes me, right? And doing some cognitive restructuring, as well as showing the person through behaviors that their predictions don't always come true. And that's kind of the core of CBT, and CBT is evidence-based for lots of problems, including depression, most anxiety disorders, and for eating disorders, as we'll see. So the original CBT manual for eating disorders was written in 1993, and this had about a 30 to 50% success rate for people with bulimia nervosa. So not, a panacea, but, still one of the better treatments, and it's a 20-session treatment. In 2008, Fairburn went on and updated his model, and it became known as CBT Enhanced. They started applying it to anorexia and EDNOS, which is the predecessor to other specified feeding and eating disorder. And research shows that it's about 50 to 70% effective in about 20 sessions. So this is a really good treatment for adults with bulimia and other specified feeding and eating disorder and binge eating disorder. And the basic model for CBT for eating disorders is this. It's dieting drives binging, which, if there's purging, drive more dieting, or sometimes it's just the binging leads to more dieting. And CBT for eating disorders works on breaking apart this cycle. And the initial target is stopping the dieting. So the main components of CBT for eating disorders are psychoeducation about this role, the dangers of dieting and maintaining it. Patients are asked to self-monitor, meaning keep food records. There's meal planning, focusing on regular eating. Regular eating is like a mainstay of CBT. So it's regular 3 meals and 2 to 3 snacks a day. Sound familiar? Very similar to FBT. Replacing strict dieting with regular meals, introducing forbidden foods, the use of delays and alternatives to prevent binging or purging, and strategies to manage negative mood states. And that, of course, overlaps with DBT. There's problem solving, a little bit of cognitive restructuring, and then the CBT Enhanced included additional modules to address negative body image, perfectionism, and self-esteem issues. And then there's relapse prevention. So that's the core of CBT. CBT, I find, is often misunderstood because some therapists who maybe get a little bit of CBT but aren't really trained in CBT for eating disorders sometimes don't understand that it's really a behavioral treatment much more than cognitive. I think some people think like we sit around and dispute diet beliefs, and really we don't. It's all about behavioral change, and it's about getting those meals into place. And the cognitions are really addressed through behavioral experiments. So if a person believes I can't eat a slice of pizza without eating the whole pie, we say, well, let's test that out. Let's run an experiment and see what happens. And that's how the beliefs are changed. So hopefully they will be able to eat a couple slices and not the whole pie, and then their belief starts to change. With CBT as an FBT, early response to treatment is predictive of long-term success. So we look for early behavior change in about the first 4 to 6 weeks, and that's predictive of long-term success with this treatment. So that's a good thing. You wouldn't like do 20 weeks and see no progress and then decide to switch gears. You get a good feel in 4 to 6 weeks if you're getting a good response.